So we're here with Dr. Peter McDonnell and Dr. Tosin Smith, who are co-chairs of this year's inaugural EyeCon conference presented by Ophthalmology Times and Optometry Times. Welcome to you both. We're so delighted to have you as our co-chairs of this first meeting.
Thank you, Cheryl. Excited, looking forward to it.
Thanks for having us.
Absolutely. So I thought first we can kind of talk a little bit about the highlights of the meeting. For our readers or viewers who are not aware, the meeting is going to be virtual this very first year. The dates are December 10th and 11th, and you can check our website for details on how to register. I thought we'd talk more about the highlights of the actual conference itself, the agenda and the faculty. Dr. Smith, do you want to talk a little bit about that from your aspect of it?
Well, I'm really excited for this year's meeting. There's so many things that we're going to be talking about. Some of the old usual stuff, getting updates on things like minimally invasive glaucoma surgery, advances in cataract and refractive surgery, but also looking at things that have sort of crept up on the horizon while we've all been at home during COVID, gene therapy for retinal diseases and other ocular conditions. And, you know, even sometimes conversations like telemedicine and COVID and how it affects us, new therapy in geographic atrophy and neovascular age-related macular degeneration. So lots of things that we're excited about here. A review of some of the older things that we have sort of learned more about and updates on things that have sort of come on the horizon in the past year or so.
Mm-hmm. Dr. McDonnell?
Yeah, despite the pandemic, ophthalmologists are an innovative bunch of rascals, and there have been a lot of exciting, interesting things, recent developments. I think that I'm not a glaucoma expert like my co-course director, and but I'm so impressed with the production of these new devices, the MIGS devices, and I'm really looking forward to learning who should get what and what's preferred in what situation. Dry eye is, in my view, probably one of the largest and most underserved markets in all of eye disease. And so to know that there are some recently approved therapies and some really exciting things on the horizon in advanced clinical trials is something very near and dear to my heart. I think the advances with the use of biologics for thyroid orbital disease is truly life-changing for patients. So it's really important that these patients get diagnosed in a timely manner, and either we start them on therapy or we get them to the person who will put them on the right therapy. Some of my faculty in my institution are now involved in a trial of stem cell therapy for retinal degenerations. So it's just, and presbyopia. Old people like me, my generation, we don't like things like glasses and reading glasses. We want to be able to see all the time. And these looks like we're going to have fairly soon commercially available preparation of eye drop to treat this scourge of presbyopia. So a lot of things that I think the busy practitioner will want to know about. That we all of us in our clinics are seeing dry eye patients every single day. We're all of us seeing patients with presbyopia, and they're going to be asking, what's the deal with this new treatment? Should I try it? Do I need it? Is it safe and effective? So much exciting stuff going on that I'm really looking forward to a lot of useful take-home tips and figuring out, what to use when and what market segments are things helpful and not appropriate.
Mm-hmm. What are the key takeaways that you would wish for an attendee to take away and come back and be able to apply to their practice immediately on Monday morning? Dr. Smith?
Well, if I had to think about it, all of us have been functioning at a certain level in our practices, and sometimes there are certain things that may be new that you're not sure you want to try. I think this is the type of meeting that gives you the kind of exposure to go home, you essentially expand your scope of practice, and then you go home and try some things that have been right at the cusp right there that you've thought about doing. But this is an opportunity to learn a little bit more, so you can go and go home and try something that will not only improve patient care, but also in the world that we live in right now, especially with cuts in reimbursement, in trying to expand what we're able to do for patients. This will allow you then figure out a way to sort of more efficiently increase income that may be coming to your practice just because of more that you're able to do for patients.
Yeah, I'm very excited about the topic of artificial intelligence and how we should be incorporating into our practices some of these new devices. So no longer are we seeing patients with diabetes that don't have diabetic retinopathy filling up our clinic. Instead, they could be tested with a device like the commercially available device for diabetic retinopathy. And then we would only see those patients that actually need to see us, that might need a procedure like pan-retinal photocoagulation or an injection of an anti-VEGF agent. So the doctors are using their time more efficiently and not doing things that don't require all our years of training. I'm very excited about the what I'm seeing as the use of AI as a way to categorize patients with glaucoma, who's at high likelihood of progressing over the next period of time. And those are the patients that we would then need to see maybe more frequently, and other patients at lower risk of progression, and we could space out their visits. So our glaucoma docs aren't maybe so busy seeing patients that don't really need to see them. And instead they're spending their time and effort on people who need procedures or some intervention like a MIGS device or other procedure. So I think some of the technologies I hope are going to let us go back to our practices and use our time much more efficiently and effectively, and seeing those patients that really need our attention, and delegating to some of these other technologies, things like screening for diabetic eye disease.
Mm-hmm. Absolutely. And I guess the opportunity also presents with this conference being held in December. It's still like one more chance to earn those credits, right? So we're offering up to 11.5 CME credits. Opportunity here to take advantage of that and get some extra credits in here if you're not able to travel to a conference. So
that's definitely true. I think we also have an array of speakers that are just excellent. I have excellent speakers who are well versed on the topics that we've talked about, and it'll be exciting to hear right from the thought leaders that know about these things. It will be a good refresher to allow us go into the new year with different perspectives and fresh knowledge.
Yeah, we need those CME credits to maintain our licensure, that's for sure. Just for me, I'm looking forward to getting to Marco Island next year, lying out in the hot sun. It's already cold here in Baltimore. But the virtual conferences have really work quite well as effective teaching tools. I think we've learned a lot how to use that technology during the pandemic. And as my co-course director pointed out, we are really fortunate to get a group of faculty that are people driving the innovation in their fields and are the some real authorities who are going to give us the pearls to go back to our practices and take advantage of all this good information.
Mm-hmm. Right. We do have a faculty, renowned faculty from around the country. So we're looking forward to that. Okay. And also next year, the event will be, we're scheduling it to be in person in Marco Island, as you had mentioned. So that's also something for our readers and viewers to kind of keep in mind, put on their calendars now for next year as well. So any additional thoughts from either of you about this year's virtual conference?
Well, I want to say to people out there, go ahead and register early and get ready to take a seat and join in us. I think it's going to be a learning experience like no other. We're going to all leave the meeting taking something special away with us.
Yeah, and now's the time to be thinking about 2022, how our practices are going to work and run. I'm optimistic that the worst is behind us with this pandemic. And at my institution in Baltimore, we are busier today than we were before the pandemic. So people are getting dry eye, they're getting glaucoma, they're getting all these problems. Some of them delayed their care. So I know that our glaucoma colleagues are busy, and as are our retina colleagues. And so I think it's a really nice time to think about how we can ramp back up on our practices and not go back to the old way of doing things, but more efficient ways to care for all the patients that need our care. So I think it's a perfect time to be doing this.
Okay, well, thank you so much. We look forward to learning more about this in the coming weeks. And thank you so much for your involvement in the program this year.
Well, thank you so much.
My pleasure. Looking forward to it.